when we think about the pelvic floor and its relationship to the breathing, if I take a deep breath in, my diaphragm descends down, which increases the pressure down onto my pelvic floor, so my pelvic floor moves down. So breath work can actually start to get a bit more reciprocal movement of the pelvic floor and the diaphragm together, particularly if that pelvic floor is really tense. And so breathing can have that twofold effect. We're calming the nervous system, but we're also getting that pelvic floor moving, which often, as I said, can be quite rigid in a woman who has endometriosis. So a lot of women will have increased frequency with endometriosis. They'll go to the toilet a lot more, and that's because their bladder is really sensitive. So we might help them to retrain their bladder, and that can be really helpful. We might, if they're having problems with sexual function, which can be a really big one. A lot of women with endo can have lots of problems with penetrative sex. So we might help them with kind of different adjuncts. Like I said, we use dilators, which can kind of stretch the vagina. We use wands, which can help to massage internally. And so these things can be helpful. And then thinking about bowel function as well. A lot of women with endometriosis can have superficial or deep endometriosis on the bowel. So opening your bowels can be really, really painful. So we talk about different kind of mechanics of how to empty your bowels. So there's lots that pelvic health physios can help women with endometriosis for.